16 to 21-year-olds who are concerned about their facial growth. Whether this is due to orthodontic treatment or has occurred naturally, we have many people in this age group contacting us, asking our advice. And I don't have time to go into a long, complicated answer for each person, so we thought we would give this short video to explain my advice in what you can do. The first suggestion is you can come here to see me, and we can see how together as a team we can change this. And the second suggestion is what you can do if you can't come here and work with me. Orthotropics and the concepts that we're based on is not a widespread concept. It is relatively new. It's not mainstream, it's controversial. And there's not a lot of people around the world doing that. If you live relatively locally and coming here time-wise and financially is not a problem to you, then I would highly recommend you come here. It does not greatly reduce the commitment that you need to put into having treatment. I still need you to change. But I can help you to change greatly. There's three main things that you need to change. And you can change these whether you're here with me or not. However, what I've noticed is people don't make changes that aren't comfortable. We all sit in our own comfort zone, and asking someone to go outside their comfort zone for a short period once in a while is possible. Asking someone to change a little bit for a long period, that's possible too. But asking people to change a lot for a long period, that's difficult. And most people find it very difficult to change to the levels where they're going to get facial change without a lot of assistance and a lot of energy and effort themselves. In theory, if you stand up straight with good head and neck posture, if you have strong jaw closing muscles, you keep your tongue on the roof of the mouth, your lips together, and your teeth in or near contact or rest, little bit by little bit, you will correct, and your face will improve, and your health with it. However, that's not easy, that's very difficult. Gains that can be made without coming here can be made in body and tongue posture. We have online some tips on tongue posture. It's important that you get the back of your tongue up, what we refer to as the posterior third. You can improve your neck and body posture, particularly following the concept of the Mackenzie chin tuck, putting your shoulders back. And there are systems like the Back Pal and the Back Tone 500 that comes from Australia that can assist you in that, as is working on your workstation, where you spend most of the time for most working people, or where school children do their homework, or students. Particularly raising a computer screen. Most of us now work at computer screens. And if you need to raise your computer screen above eye level, I simply have a pile of old books sitting underneath the base of my computer screen. So when I'm at my computer screen, not only do I have a nicely designed high back chair with a good lumbar support, but I have my computer screen above eye height, so I'm looking up slightly. That gets me naturally into a better body and neck posture. In addition to this, you can work on the function. Now, of course, function's not as important as posture, but posture and function work hand in hand. And affecting function is very useful. It can drive posture, and that can drive change. We have, again, some techniques on changing your function and your swallowing pattern online. Also, you can see some specialists in this area, referred to as myofunctional therapists. There are several in the US that work on Skype and can give you therapy online that is very effective. Again, you need to work hard on that. And finally, you can work on your muscle tone. You gently build up your masticatory muscles. And we recommend chewing gum. We are bringing one to market, which is never easy, and we're hoping by Easter 2015 to have one on the market. But there are several other, a lot to go by the term of mastic, that you can find online. And you really need to do a lot of chewing, but if you've got good chewing muscles, it helps bring up your facial complex. Remembering that the two most significant contributors to facial shape is the posture of your tongue, particularly that back section, up on the roof of your mouth, and the strength, particularly the resting strength, of your masticatory muscles. You need to work on these two aspects particularly hard, and don't expect results overnight. I know we live in a world of instantaneous gratification, but such things take you years to achieve. Years of hard work and dedication and standing outside your comfort zone, because comfort is to some degrees your enemy. You're comfortable where you are now, that's why you're not going to change. To change, you need to change that.